We have one question here. Can you please address current research findings on the risks of long-term lithium use? So there are there's a fair amount of evidence that over one or more decades of continuous lithium treatment, that a susceptible person may develop gradually declining kidney function. This is a bit controversial in the sense that we're not certain that the lithium is the culprit, but most of the evidence points that way. We protect lithium users by doing tests of kidney function several times each year that the person is taking lithium, so that we can catch this early if it occurs. Then stopping the lithium will prevent further decline in kidney function. There is a much smaller amount of evidence that lithium treatment chronically may cause some sluggishness of the thyroid gland and may also cause some increased function of parathyroid glands. And so these should be monitored by blood tests several times a year while you're taking lithium to detect these should they occur. People taking lithium sometimes complain of chronic thirst, and it's true that lithium causes the kidney to increase its output of urine. So you pee more and you're thirsty. I would urge people who have that side effect to consult with their psychiatrist and to try to carry water with them wherever they go.
Thank you.
So two questions that actually I can just address by having additional resources added to my slides is where can I read more about attenuated symptoms to include an assessment, which is a very important question. There are some screening tools available for that, and I'd be happy to provide those references. Also, how do I get info on Pennsylvania's 8 programs? Also, we'll make a list and include those in the materials as well.
Thank you.
Thank you.
Thank you. Dr. Salsa?
Okay, so the question is, does emotional face recognition in a family system give a clue to or merged with genomics? And we have done it. So I didn't go into that, but people with schizophrenia and people at risk for psychosis have difficulty identifying emotions on the face. Happy emotions, babies can identify, is not an issue, but more negative emotions of anger, a frightened face, they do have difficulties that are similar to individuals with autism. Remember the genetic overlap that Dr. Baratini was talking? So, in collaboration with the Harvard group, we asked, there's a polygenic risk score that puts together all the genetic sensitivity to schizophrenia and asked the question, does performance in the large sample that Monica described, Dr. Kalkin described, does performance on this measure of looking at faces on the computer and clicking, happy, sad, angry, fearful, does this relate to the risk for psychosis? The answer is yes. The more poorly you do, they increase the risk for psychosis. It has implication for daily functioning and for therapy. Many times parents, we see, tell us that they get frustrated with their child, even if the child is an adult, saying that my face is so mad, and they don't care. They don't show me that they care. They don't communicate to me. They cannot read your face, period. There's a deficit in the brain There's a brain system that relates to facial recognition. They cannot do that. Likely born this way. So what's important is to train them. We now have an NIMH grant that Monica, Dr. Green, and Ruben Gore are involved in, and myself, of training young people at risk to relate emotionally. You can teach people to do that, and they're improving on it. And also, when you communicate with patients, your clients, children, family members, tell them, I feel visual is not enough for them. Repeating the visual with verbal, I feel mad now because of this and this. Rather than, assuming that if you had a bad day at work, you come home and they can read your face, they can't do it. So this is something that we can do something about, and there are very interesting findings that are being related now in most studies for genomics. Thanks.
Thank you.